Yeah.
There we go.
All right, perfect. So I'll just restart. Central Alberta Falls Prevention Coalition is a group of people who are interested in seniors' health and well-being, and specifically passionate about the falls prevention, physical activity, and healthy lifestyles. Hence, us focusing on these areas through education, awareness, promotions, campaigns, and workshops and webinars, much like this. We welcome new members to join our coalition and the Core Falls group, and our amazing tech support. We'll put in all the links for those. So my colleagues, Shelley Dallas-Smith and Michelle Sharp, are also here, and they are supporting us behind the scenes today. Shelley is monitoring our chat for questions, and Michelle, as always, is helping us with everything else, much like Cindy, who is also our tech support. So thank you, ladies, for being here. If you have any tech concerns, feel free to private message our tech support wizard throughout the chat, and she will be able to assist you. It is my pleasure to welcome you all. As you're arriving and settling in, if you're able, again, we invite you to write in the chat box your name, location, and organization. We'll give you a little bit of time to do that throughout. Okay, so to begin, we are fortunate for the opportunity to come together in this virtual community space, and we are doing so from all across the province, which is absolutely fantastic. In the spirit of our journey of promotion and reconciliation, I would like to honor the truth of the shared history and acknowledge the traditional territories of the people of Treaty 6 and 7 regions, which is the area which I am in. As we are sharing this virtual space and you are coming from different locations and different territories, I invite you to offer your own land acknowledgements within the chat box. All right, so, and to make sure that everybody is comfortable, we have a few housekeeping items. We have set this up to offer interactivity, so everyone is able to unmute and mute themselves and turn on your videos on and off. Please feel free to turn on your videos, so if you like, so that we can see all of your faces, or turn it off if that is your preference. You can give us a wave, a little thumbs up. We ask that you please mute yourself unless you are sharing a comment or a question during the event, especially during the presentations. I'd like to draw your attention to the bottom of your screen for our participants icon. Click on that open link and you'll see an option to raise your hand. Later on, we'll be inviting people to click that when they want to speak to help us manage the conversation. You are also welcome to use the other buttons to communicate, such as a thumbs up, the yes, the no, there's a little heart. It's pretty interactive, it's fun. All right, so within our chat box, we encourage everybody who is able to use the chat box to share resources, comments, build community, and Shelley will be helping to moderate the chat box. Shelley is a health promotion facilitator with AHS. We can see people have been sharing their name and location already. Thank you so much. If you have just joined us, you are welcome to share who you are in the chat box as well. All right, so this session will be recorded. Thank you everybody who clicked that little yes box, and a recording link will be shared via email and on the Core Alberta after this session. Our tech support will now start the recording. That's where it was supposed to be, thank you. Our agenda for today's Target Senior Falls event is as follows. Our first presenter is Rita Lemoyne. Rita, did I pronounce that properly?
Oh yeah, plenty close.
Perfect. I love it when I nail it. It works out good. A seniors health coordinator with AHS. We will have 5-minute question period after each presentation. So if you have any questions, of course, put them in chat, but you can also save them for that 5-minute block there. We will jump into our next presentation with Jennifer Suttenberg, a dietitian public health with AHS. So we have both Rita and Jennifer up there for you guys today, followed by, again, another 5-minute question period. During each presentation, we ask that you write your questions in the chat box. Shelley will be keeping a keen eye on the chat box throughout the presentations, so all questions will get asked and answered. If you will also be able to unmute yourself again and ask the questions during each question period if that is your preference. So jumping right into today's session, I would like to introduce you all to our first presenter, Miss Rita, a seniors health coordinator with AHS. Rita will present today on seniors and their fear of falling. So Rita, I have your bio here. So Rita has been practicing as a registered nurse for 26 years. She has worked for 10 years in acute care and the last 16 years supporting seniors in long-term care, stroke rehabilitation, and mental health. Her most recent role has been in supporting seniors' mental health within her community. She is looking forward to returning to supporting seniors in long-term care later this month. Congratulations, Rita. That's really honorable and wonderful. In her spare time, she likes baking, reading, and walking with her dogs. Thank you, Rita, for joining us, and I will let you take over.
Okay, so my presentation today is on the fear of falling and how it affects our seniors and how we can help them overcome that. The fear of falling usually comes because everyone has a vested interest in keeping our seniors safe, and the fall risk, once you have discussed it or thought about it, once you get to a certain age, I guess, is that it interferes a lot with your activities. You're very scared you're going to fall. You know the risk if you fall that you could end up in the hospital and from there be debilitated enough that you will have to go to a nursing home. And a lot of our seniors and families don't have a very pleasant picture of what a nursing home looks like, which is, I totally debunk that every time I talk to somebody, because our nursing homes are not nursing homes like even they were 10 years ago. A lot of our older ones now are actually demolished, so you can't even find an example of them anymore. But that is a very real fear that they will lose all their independence, all their friends if they have to move, and they might even be away from family if they have to move far enough away. So that is a very, very real fear that seniors have. The families, of course, want to see their loved ones healthy, independent, enjoying things, being able to attend activities with families or with friends, or go on outings or trips that they would love to do, that they have been doing. And this fall, if they were to have one, would then stop that. It would definitely increase the burden of care on the family. There would be a lot more things to consider. So the two sides of the coin, the family don't want their seniors, their loved ones injured. They don't look forward to, per se, although they, I mean, that it's hard to say, but I mean, you don't really want to increase your burden of care. You want to enjoy life with your loved ones. You don't want to have it painful or stressful in visiting and being with them. So seniors have a very real reason to be scared of falling, and families have a very definite reason for this fear that their loved ones might fall. And this can put people at opposite sides. The seniors definitely don't want to lose their independence, and the families, again, though, don't want to see their loved ones injured or debilitated in any way. So when I'm talking with seniors and families, I try to encourage seniors to get a lifeline. And the first thing they think, well, that means somebody's watching me. That's somebody's worrying about me. I'm losing my independence. I won't be able to do whatever I want, which is an unrealistic fear. So education is provided. Education in that this is like motor vehicle insurance. Everybody drives a car. We don't think we're going to get in an accident. So we just take precautions. We just put added insurance. And to families, I offer that seniors have been careful all their lives. They are still active. If they maintain that level of activity, if you don't restrict them, they will in fact maintain their balance. They will maintain their physical health, and the fear that they will actually injure themselves or fall can therefore be waylaid a little bit and not not so much in the forefront. So that's the two sides that are very, very dynamic and very important to both parties involved in the decision and in the response to falling and the fear that there will be an accident and injury. So the fear of falling has its advantages. For the seniors, if you're scared of falling, you have a constant surveillance. You are watching where you walk, you pay more attention, you don't go out maybe when it's icy, or if it is icy and you want to go out, you make sure that you have proper boots on, proper salt on the sidewalk. There's a lot of things that we check and make sure that it's there for us to support us so that we're safe when we go out. Go out in good daylight hours, not on a dark, snowy day where your vision isn't quite so good maybe. So yeah, there are advantages to being more cautious, to be more aware of where you're going and whether you can actually take your walker with you, or whether you're going to need to rely on somebody else helping you upstairs or through a narrow passageway or whatnot. So there's a lot of ways that you can notice and take advantage of pre-planning and making sure you're safe. Of course, there are disadvantages to this. If you become so fearful that you are not going outside, you are not doing these activities, then this lack of movement, this staying in the house actually is a detriment. It actually, oh, sorry, I didn't move my screen. There. This actually reduces your physical balance, your ability to walk safely, and you can actually, through lack of conditioning, lack of physical strength and coordination, become a greater fall risk. So again, that's an education that you offer to families and to others, that restrictions are not good. Cautions are. Being aware of your surroundings are good, but actually restricting activities is not beneficial, because then you lose your range of motion, you lose your ability, your endurance, and you actually end up in a worse place than if you were cautious and kept moving. So the reduction in physical activities then have the potential for depression. If you're not enjoying your gardening, if you're not going out to the mall for coffee, these things, there's inherent dangers in them. Yes, walking in the garden is uneven ground. Walking in a mall, you could be distracted. Somebody could run into you. Getting groceries, you're leaning over, you're standing up. There's a lot of things that there's inherent dangers that are barriers, and you might feel that I'm not safe doing these. But if you stop doing these small movements, these small engagements, you lose your physical abilities, then you become isolated. The potential for depression is very high, and cognitive decline. If you're sitting at home and not interacting with things that are beautiful, or having socialization with people, or any of these other activities that we take for granted, you actually do have a significant risk for cognitive decline, both because you're depressed and because you're not exercising your brain. So physical exercise is important for maintaining your stability and your balance, and it's important for keeping your cognitive health and mental health as well. Sorry, I'm getting behind again. So the fear of falling has far-reaching effects, and once these start to happen, they're very hard to change. Once you start slowing down or restricting your activities, then again, you can't do them. You do fall when you lean over. You do trip when you go walking because you didn't take your walker, or any other thing like that that would put you at risk. The other thing that also happens when you stop and slow down and restrict yourself is you develop anxiety. Now, if I do go out, I haven't been out in a long time. What's going to happen? Where do I find myself? I'm not where I should be. I don't know the pathway anymore. I don't know the steps anymore. I don't know the direction that I'm going. And this also increases the anxiety then. So it ends up being a very vicious cycle where the more anxiety you have, the more you restrict your movements, the more you restrict your movements, the less physical ability you have to do any of that. And again, there goes the anxiety through the roof because you're worried that you are gonna fall. So how can the community and others and families help families manage, seniors manage and reduce their fear of falling? So what I like to tell people is to keep complications to a minimum. So provide, a lot of seniors' homes don't actually have enough lighting in them. So increase the light bulb wattage, put more lights up, make sure it's well lit. In buildings, we can put extra signage, markings on the floor. You don't think about it when you're walking, and you don't have to look at where you're walking, you just walk. But there's a lot of uneven doorways going in or up the steps, like over a doorways type step. For seniors with a walker, that's important. So mark it or put extra lighting there. Make sure that it's visible so they don't walk into it with their walker and then lean forward and it's a trip over the walker. Easy access. A lot of doors, you don't really think about it, but you go to push on it. Now, if you had a walker in front of you, would you be able to open that door? Would you be able to get your walker and yourself through the door before the doorway shut on you? That is a hindrance a lot of times to seniors. Again, if they're waiting for, I don't know, in line up for something, chairs, is there some place where they can sit if they're getting tired? A lot of small businesses, and this is more difficult, but are your pathways between your displays, is it wide enough that you can actually get a walker around? Is there room for two people to walk side by side if somebody's going to walk beside their seniors? So, it can be very, very small things can have a very large impact on their ability to maneuver around in the public. The other thing that I think could be done for seniors, which would be, again, a very simple thing, is walking groups. Churches could start a seniors walking group with the people that attend church. Libraries could do it. You can walk around a library. Usually the aisles are pretty wide there. Malls, sports centers. I know the Cullicut has a walking program. There's a lot of places that we can start a walking program indoors, which allows us to ignore the weather and the dark winter and all that sort of thing, and just keeps us moving. The movement is the best hedge, the best way to avoid developing a fear of walking. So these small changes can provide huge dividends in safety, and providing this can and then reduce their anxiety. If they're still having anxiety with walking, even though they're moving about and they're active, then anxiety is real. I mean, it is real in all cases, but then maybe we need to look at their anxiety. Are they recognizing it? Are they recognizing that it's more the fear of doing this that's maybe restricting their movements than their actual physical abilities? And in that case, they need to recognize that this is my fear response, this is my anxiety response, and we need to help them then to develop strategies for reducing that innate fear, that innate anxiety. And what I like to tell seniors and families a lot is, I'm a senior, you're a senior, you've made it this far, you've done this before, you've been here before. In different situations, you've dealt with anxiety. In different situations, you've dealt with fear. So what did you use? What were your strengths? How did you manage to make it through that? And once you think, oh yeah, when this happened, I was stressed, but this is how I refocused, or this is how I calmed myself down. We don't think of it as when we get older, we start to think, well, anxiety and fear of everything because we're getting older, fear of falling is normal. No, you've been here before, you've managed these feelings before, you can do it all. We just need to remember that we've been here before. So I give some tips on how to manage anxiety, how to say no. Hey, stop talking to me that way. I've been here before. I know how to do this. I'll just focus. We're going to do this. We got this. We can do this. This is not something that we need to actually fear. So I think with maintaining physical activity, talking back to yourself, we've got this, we've done this before, we know how to manage our anxiety, the fear of falling can be greatly reduced, and we can have an active and fulfilling senior's life.
Wonderful. Thank you, Rita. We now have a, sorry?
You're welcome.
Oh, yeah, okay. We now have a 5-minute question period. Shelley, does anybody have any questions regarding Rita's presentation?
I'm not seeing anything in the chat box. Would anybody like to unmute?
I think I see a question from Carolyn in the chat box.
Oh, sorry about that, Carolyn. What are suggestions to motivating seniors to be more active if they choose to sit in front of the TV? They have done their work time and now deserve to rest. So what's your response?
My response to that is a step down from what we tell everyone, that 10 minutes a day will do it. That's fine. Because watching TV or doing your hobbies or your crafts is a really good idea as well. TV's not so much, but you know, you should enjoy your leisure time, but try walking around the house once a day. Walk to meals. Don't have your meals brought to you by family or staff. Walk to the dining room. It doesn't have to be actual distance walking. Walk around the block. And for goodness sakes, walk slow. We're not in a rush. Enjoy the flowers, enjoy the sunshine, enjoy the atmosphere wherever you are. It's the movement forward, not the speed. We're not going for cardio. We're not going for exercise. We're just going to smell the flowers. We're not, yeah. That's the way I approach it, is small, 3 times a day or 4 times a day, and do it at a very leisurely pace. Never, we're not exercising. Remove the word exercising from it.
Thanks, Rita. I mean, it really depends on the individual and where they're at, and yes, that's a good response as to meeting an individual where they're at, because they're not going to buy much else to start with. It's probably a good starting point, or maybe that's just a good maintenance. So that kind of functional mobility piece. Kathy, Kathy has a question here: is do you have a printable resource on reducing anxiety for seniors?
There is a brochure that Alberta Health Services puts out. It's called Depression and Anxiety. I didn't bring it with me, I don't think, but it is available through Alberta Health Services, and that's what I handed out. And it's self-management, I believe is the word, self-management of depression and anxiety. And in there, it offers sleep habits, good sleep hygiene, basic nutrition. I also encourage seniors to drink anything, coffee, tea, I don't care what it is, because dehydration can make you dizzy. So that's another thing you'll go to get up and you'll go, oh, I'm dizzy, so I can't do this. No, you're likely dehydrated. That's the first thing that causes the dizziness for the most part. So, but that booklet is very good because it covers everything with good ideas and examples. I'm really sorry I didn't bring the booklet with me.
Rita, was it created specific to the senior population, that resource, or is it a general?
No, it's a general mental health. No, it was in the 49th Street Clinic, regular brochures hanging on the wall.
Okay. Maybe we can look for that. Kathy's second part of the question was is it specific for fall anxiety? So it wouldn't be specific then, just more of a general question.
Yeah.
Okay.
Yeah, I don't have specific for fear of falling. The resources that I listed were specifically for fear of falling. They were what I utilized to do this presentation, but I don't personally use any of it. I just, I use that brochure because it's really nice. You hand it to them. It's a book they can read. They don't usually lose it. It's blue. And now I think the new one is white. So yeah. But
sounds like a resource that may be good to be developed, specific to seniors as well.
Yes.
Okay.
There are not anything, there's nothing that I'm aware of now. I've only been in seniors mental health for 3 years. But there are no specific booklets or pamphlets for seniors with Alberta Health Services that I'm aware of.
Okay, there might be something with another organization. Yeah. Sorry, I missed a question earlier from Jennifer, and it was, what about using the little QB, those sitting pedal machines? Is there any benefit with those?
Oh yeah, absolutely, absolutely. With that, it would be, I would think, more circulation in the legs. Sometimes seniors won't want to walk because their legs get too sore, too tired. Knee problems as well. They'll put that forward as a reason not to walk. So yes, sitting, watching TV and using one of those would be an excellent idea for leg and lower limb circulation. I don't think it would help with your hips or total endurance, but other than that, absolutely, positively, yes.
Wonderful.
All right. Any other questions that come to mind? I'm not seeing anything else in the chat box, but you certainly some of the questions have given us some things to think about as well to take away as a coalition or a group. So, all right.
Excellent, thank you. All right, so, sorry, I keep on talking over people, I apologize. Moving onwards and upwards, we are going to go to our next presenter. I would like to introduce you all to our second presenter, Jennifer Suttenberg. She is a dietitian public health and home care with AHS. Jennifer will be presenting on the malnutrition risk screening in relation to falls prevention. So, I have Jennifer's bio here. Jennifer has been practicing as a registered dietitian for 29 years. She has worked in various areas, including acute health, long-term care, home care, and public health. Her most recent role in nutrition has focused on the older adults. She has completed continuing education courses on dementia and has also been working collaboratively on a malnutrition risk screening project, which she will discuss in her session today. In her spare time, she likes to cycle leisurely, listen to Disney podcasts, and spend time with her family. Thank you, Jennifer, for joining us today.
Thank you, Bonnie, for the excellent introduction. I really appreciate it. And good morning to everyone. Thanks also to Rita for such a great presentation today. It was very eye-opening to even hear about the anxiety that is connected with the fear of falling. So for my session today, I've titled it Nutrition Screening in the Community. And what I wanted to talk about, my outline is, first of all, I'll talk a little bit about what is nutritional status and also what is nutrition screening. And from there, I want to get right into the screening project that I've been part of in Central Alberta. For those of you who attended my session with CORE back in December 2021 regarding this project, I want to let you know this is a continuation as we now have some evaluation results. And I'm really glad that I'm part of this initiative that I'm going to be talking about. It fits my role really well as a dietitian. Right now, I work in home care, so I do direct service with clients. So I really get to see what they're facing regarding their nutrition needs. As well, with my role in public health, I have an impact in the community by looking at prevention of nutrition issues. So that's where this project comes in. So it really works well for me. A copy of my presentation will be available afterwards, so you don't need to madly scramble down any words. We will have that available for you later on. Okay, really just to get started with a little bit of background information, what is nutritional status? So a person with good nutritional status really has a nutrient intake and absorption that meets their requirements to stay healthy. So when there's an imbalance between nutrient intake, absorption, and requirement, then that's when we see malnutrition. And for today's topic and discussion, I'll be focusing mostly on the undernutrition component. So we know many older Canadians are at risk, nutritional risk, and poor nutrition can lead to weakness, frailty, tiredness, and falls. And also some studies do show that falls is an outcome due to poor nutrition. Thus, it's really important to look at nutrition intervention to help reduce the risk of falls. So a little bit about nutritional status. I'll let you know a little bit about what we look for with nutritional status. This is just a really brief overview. Of course, there's a lot more to it, but I wanted to give you a few highlights in this area. So when we are assessing somebody's nutrition status, first thing we look at obviously is food intake. We know that eating poorly has been found to be a really good predictor of malnutrition, especially if this poor intake has been going on for many weeks. Unintended weight loss is also a really good predictor of malnutrition, and it can result in weakness as well as reduced abilities with daily activities. And in addition, if there is low body weight that's related to malnutrition, this increases the risk of falls by accelerating bone loss, impairing movement coordination. It can also reduce reaction time, increase our bone fragility, and reduce muscular strength, which ultimately can impact our gait and our balance. Protein, first of all, when protein intake is less than what we actually need, we end up with muscle breakdown and muscle loss in our bodies. And this can also lead to decreased strength and activity levels, and can make it hard to be mobile. And we also see less function and more frailty when our protein intake is down. As well with fluids, Rita mentioned this a little bit, but inadequate fluid intake is often linked to poor food intake. And age-related changes such as decreased kidney function, a conscious decision to not drink fluid because of incontinence, or perhaps a diminished sense of thirst. These can also increase the risk of, these can all decrease the risk of, increase the risk of dehydration. This can cause dizziness or tiredness, which can also increase falls risk. Now, I often get asked, well, how much fluid does an older adult need? And as an overall general rule, the minimum requirement that somebody needs is at least 1,500 mils a day. So that's what we look for, especially when we're looking in facilities and long-term care. We aim for 1,500 or more. There are many other nutrients that we look at when we're talking about nutritional status with our older adults. I have these listed on the screen, and at the end of this session, I will give you more information on where you can find details on these nutrients. There's a resource called Seniors Health Overview that you can take a look at. But at this point, just because of time and how much information is on these nutrients, I'm not going to cover them in detail right now. Now I want to turn your attention to nutrition screening and the screening initiative that I've been a part of in Central Alberta. So Screen 8 is the tool that we use. It is a 5 to 10 minute nutrition screening questionnaire for those older adults that are living in the community. It identifies nutrition problems early on, or what we call upstream. And it can be used to identify those older adults that might need some nutrition education, community resources, or a more comprehensive nutrition assessment to determine the extent of their problems. Screening can also be used to help diagnose malnutrition. Now, the creator of this tool is Dr. Heather Keller. She's out of the University of Waterloo, and she's also part of the Canadian Malnutrition Task Force. And just shortly, I'll show you an example of the Screen 8 questionnaire. But first of all, why screen? Well, we know screening can help prevent malnutrition. Malnutrition has negative consequences, and it's really prevalent enough that it makes sense to screen. So some information that I found available on the Canadian Malnutrition Task Force website shows that 1 in 4 patients who are admitted to hospital are actually malnourished, and many of these malnourished patients are older adults. Malnourished patients are also 2 times more likely to be readmitted to hospital. Also, a malnourished hospital patient will stay 2 to 3 days longer than a patient who is well nourished. And that has a cost to it, to the acute care system, as you know, and it's in the billions, $2 billion a year. And in addition, 1 in 3 seniors do have some difficulties meeting their nutrition needs. So best practice is to screen to identify nutrition risk in all settings, regardless of weight status, and using a validated tool for the appropriate setting. Okay, so our project that I want to talk about today ran, the pilot part took place from June 2021 till the end of November. And it is the first malnutrition screening initiative that was aimed at independent community dwelling older adults in Alberta that I'm aware of. And I am pleased to let you know that even though the pilot is done, the screening still continues for our project. And the partners are all still connecting on a regular basis. So the members of the initiative are listed on the screen. So we have the Golden Circle Seniors Resource Center in Red Deer, 2 Central Alberta PCNs, 2 Alberta Health Services departments, as well as the U of A that's helped with the data collection. And Dr. Catherine Chan has led the data collection and evaluation along with Rani Fedorik, our master's student. So when I do get into the evaluation component, I often talk about we did this, but ultimately it is Dr. Kathy Chan and Rani that did all the evaluation. But our group is so well connected and we work so well together, I often use the word we. Okay, so screening questions on the Screen 8. Interesting enough, you're probably looking at this list and saying, Screen 8, there's 10 questions. Anyway, the Screen 8 actually involves the first 8 questions. So those are the validated questions that our older adults are asked. But for our initiative, we also wanted to find out more information on questions 9 and 10. So we did add those questions. However, those weren't part of the evaluation and they were not scored. So those who administered the questionnaires, we call them the screeners, had training before they began. So they became aware of the screen tool, as well as resources and tools that they could refer to. This is an actual sample of the screening questionnaire that we use. I know it's quite small, but like I said, you will have access to this later on. So it shows you actually the actual questions we do ask our older adults. The writing in red are the prompting types of phrases that we give for our screeners, just to help them clarify some of the questions. So after the screen is completed, the screeners do tally the score, and they give a score of either based on high risk, moderate risk, and low risk. This is a flow sheet that was also developed for our screeners. It tells the screener where to direct the older adults depending on their screening risk score. So it makes it really nice and easy for our screeners on where they go next, depending on the score. And at the bottom of the questionnaire, I just wanted to highlight the section on the screen, referrals and resources. So we do have a section, and this is in particular for the Red Deer screening group, referrals where our clients could be sent, or any handouts or class recommendations that were made. And as well for the pilot, we did also have a little tick box if they consented to be interviewed later on. So we use that part as well as our screening tool. Okay, and this is just a sample handout that we have based on where somebody might be screened. So if someone was high risk or maybe moderate risk, or they weren't eating quite well, this is just one of the samples of the many handouts that we have available. Our screeners have a full list of resources and handouts that they can choose from to give the older adult if needed. Staying strong and healthy as we age is a virtual group session that was initiated because of this project. However, anyone can now attend, and it is free. So it's about 1.5 to 2 hours long. It's very interactive, and it touches on both physical activity and nutrition for the older adult. So if that is something you might be interested in, or you have clients that might be interested in this, feel free to refer them to this class. Okay, next, I want to talk a little bit about the evaluation component of our project. So I'm really giving a real broad overview of evaluation. More information will come at a later date. But what I wanted to let you know with the pilot is that data collection is now complete. And for the evaluation, we looked at 3 main areas. First, we looked at the nutrition screens, and we were able to collect a total of 276 of them. As well, we interviewed older adults, and we also surveyed stakeholders. So our stakeholders were the administrators, health professionals, and screeners. So now I'm going to tell you a little bit about each of these sections. First of all, the nutrition screens. As I've mentioned, we have 276 that were completed, and what we found was that, well, they were categorized into high risk, moderate risk, and low risk, as I'd mentioned before. And of the 276 screens that were completed, we found that 50% of community dwelling older adults had moderate nutrition risk, and also 8% were high risk. The average score was 33.9, and that is a score that's considered moderate nutrition risk. So we do know that moderate nutrition risk is prevalent in our community, and this is a real critical time that we can provide services and intervention for our older adults. And just a side note, when I was looking at some of the data, I did note that unintentional weight loss, skipping meals, and eating alone were 3 common issues that were noted. Okay, the second component of our evaluation was the component where we actually interviewed older adults. So after they were screened, we did do that question where we asked if they wanted to have a further interview with us to just get some more information from them. So we did have older adults that did consent, and from the interviews, we found that there were 4 broad themes that came up with our conversations with them. So the first theme that came up from our older adults was that they found that discussing nutrition is important and valuable. And one of the comments that was made by one of the interviewees was, I think it just calls to mind that we sometimes don't follow the food guidelines when we get older. It's easier to just have some toast or whatever. So it makes you think more of what you should be eating. A second thing that came up with the interviews was that a referral to a dietitian is fast and simple, and the appointment is helpful. So this theme really captures the importance of referring on and how referring can help a client even further. It's interesting to note, though, that some of our screens that were done, we had some clients that screened as high risk, but they did decline referrals. So interesting, could be some follow-up work there. Okay, a third thing that came out, which I found very interesting, was that our older adults that were interviewed had a preference to talk about nutrition problems in the third person. So this theme demonstrated how nutrition issues seem to affect other people, but not the person being interviewed. Nutrition problems were most often discussed, included low income and high food costs. So one of the quotes that we have down in our report states from one of the clients, "I'm better off than a lot of them, and they have found it really, really hard eating properly, being able to even afford to eat on a pension." So the tendency to speak in third person is really interesting. Maybe it stems from negative connotations associated with being categorized as malnourished, and maybe they link it to poverty or a lack of self-care. And perhaps maybe some of our clients are afraid to admit inadequate intake because maybe that's the first step to losing their independence. So interesting that that came out. And the fourth theme is recollecting appointments is difficult. So I know a lot of our seniors or older adults have a lot of appointments. And so some of them did forget that they were actually screened. And this may or may not have to do with the project. It might just have to do with, like I said, older adults having lots of appointments. It could have also been due to the screening interview being quite far apart in time from the further assessment interview. So if we kept the interview and the screen closer together in time, they might have remembered better. Or perhaps it had to do with memory, or maybe for some of our clients that were screened, it was part of another appointment. So for example, if they had a diabetes follow-up appointment, they were screened during that appointment. So it all kind of blended together perhaps. But again, interesting. It's important to remember that this is a theme that came out as well, and for further assessment and review, something to keep in mind. And I have a couple of comments that I want to further just mention. So this is from our patient advisor that was part of our malnutrition working group. During the process of being part of the implementation, I have picked up useful healthy eating tips to help prevent things like bed sores and muscle wasting. I recently had my own referral to a dietitian to improve my calcium and protein intake. She is currently working on a nutrition care plan to help me regain my strength so that I can continue to live independently. And then another comment we have from a patient. It made me realize the importance of nutrition, and if you need help or assistance of any type, that health services are there. It was good for me. It got me sort of on track with my eating habits again, and I'm even starting to put a little bit of weight on. It has improved my quality of life. So that's just a couple of comments of many that we received. Okay, and the third part of the evaluation with this pilot is the feedback from stakeholders. And as I've mentioned already, this included screeners, administrators, and healthcare professionals. So I do have some preliminary information to share from the surveys. So the aim of these surveys was really to find out the experiences about the screening process and thoughts about the feasibility of implementation of a screening program. Now, I know this is a little bit small, but I'll give you a broad overview of what's being said here. So specifically, when we looked at some of the information from the screeners, we used what was called a Likert scale to pose questions. So this is a scale from 1 to 7, with 1 being strongly disagree and 7 being strongly agree. So all questions that were asked of our screeners received a score of 5 or greater. So that indicates that there was agreement in every question that was asked. And also most scores were greater than 6. So we do have a high agreement with a lot of the questions. So a broad overview of the screeners' feedback found that nutrition risk screening can be successfully carried out in the community. The screening tools were found to be user-friendly, easy to implement into workflow, and have the potential to reduce nutrition risk. The screeners also agreed that nutrition risk screening is beneficial to older adults and supports their needs, and it has the potential to reduce nutrition risk. And screening provides opportunity to educate about nutrition risk. The screeners also found that there were community resources available to refer to, which is very important when you are doing a screening program. A little bit of information from our administrators. So we do have initial data from them. So we had 3 sites where administrators were surveyed: the Red Deer Golden Circle Center, the Red Deer PCN, as well as the Peaks to Prairies PCN. Again, we used the Likert scale of 1 to 7, with 1 being strongly disagree and 7 being strongly agree. So regarding feasibility, when asked about Screen 8, if it had the potential to reduce nutrition risk, the mean score from our administrators was 6.2 out of 7. So they strongly agreed with that statement. And also when asked about if Screen 8 can be implemented into daily workflow, the administrators again strongly agreed with a score of 6.6 out of 7. Regarding acceptability, when asked about if screening had benefits for older adults, again, a high score of 6.7 out of 7. So we still have further information to come. A lot of the data is still being worked on. So more information is still coming regarding the surveys, in particular, more questions about the administrators, as well as healthcare professionals that were also involved with this project. So getting on to summary and further work that we've come up with this project. From the patient perspective, screening for nutrition risk was considered to be acceptable and also increase the awareness of the importance of nutrition. When screening, it's also important to really think about developing strategies to be respectful and candid when we communicate nutrition risk to our older adults. As you can imagine, telling somebody that they're malnourished or at high nutrition risk might be a little bit uncomfortable. So we need to be able to tactfully discuss this with them so that they are more open to receiving care or support to keep them healthy and independent. Other important aspects of the screening program should include following up with individuals who were referred to services, so we can see if the referral was effective and ultimately did their nutrition risk improve. As well, we also need to follow up with those clients who perhaps refused a referral and maybe they're high risk. Maybe we need to do more work there where we do another follow-up to see if that will help encourage a referral in the future. And we also need to be able to clearly and accurately promote resources that are available. When we can describe resources and referrals really clearly, our older adults are more likely to agree to support. From the stakeholder perspective thus far, we still have more to go. It was found that screening is acceptable, appropriate, and feasible. It was also mentioned that a screening program needs to have appropriate resources and services to refer to, and they need to be updated regularly. So all our screeners, administrators, and anybody involved with the screening program should be aware of all services and resources available in their community. And there also should be a really strong focus on making referrals and providing resources to anybody who does screen as moderate or high risk. So we do know screening is a quick and easy way to identify nutrition risk, and it does have the potential to prevent and detect malnutrition. And of course, communication is important. Communication among the malnutrition risk screening team is very important. So having regular meetings to discuss process, issues, workflow, and to talk about the importance of what they're doing will really help with having a successful program. And also sharing data and statistics with everybody is so important, as well as with physicians, because we know that data drives change and people are more likely to support a program that is they're aware of, right? And we also need to communicate with our older adults. And finally, just to give you a few resources that are available. Again, you will have a copy of my PowerPoint, so you don't have to write these down. But right on the Alberta Health Services website, if you go into the search block right at the top, you can type in any of these words in quotation, and you will come up with some good resources. There is a malnutrition page right on the AHS website, as well as the Seniors Health Overview that I mentioned, gives a really good summary of nutrition issues and areas we need to highlight with older adults. Also, if you're looking for nutrition education materials, you can see where you can get those. And more information on our class is also on the AHS website. I also want to highlight a couple of websites that I got a lot of my information from for this presentation. So the Canadian Malnutrition Task Force, which is an excellent resource. And also Dr. Heather Keller's information is on the Older Adult Nutrition Screening website. So a lot of tools there as well. And I'm excited to announce that we are within Alberta Health Services coming up with a little bit of a success guide to screening in the community. So this is not ready yet. We've only done draft 1, but it's coming in the future. I can't give you a date yet, but it is coming. And I think that's where I'm ending it today. So thank you. And I'll stay on the line for a bit here and let Bonnie take it over.
I always do that. Started talking when I was muted. Thank you, Jennifer. We now have a 5-minute question period. Is there any?
Yeah, I see some questions in the chat. And yeah, there is. So Kathy Gladwin asks, I'm not sure if you looked into this, but does diagnosed diabetes correlate with better or poor nutrition habits? Did you have, and I'm curious then if you had any clients in your pilot that had diabetes?
That's an excellent question. We did not break down diagnoses in our pilot. So I don't have an answer for that, Kathy, but that might be definitely something that could be looked at in the future with a screening program. But sorry, we did not look at that.
Good, thanks, Jen. I have a question, and then Carolyn has a question I'll share. Is there any thought to developing a self-screen for seniors? So Finding Balance has developed, like, are you at risk for a fall, that seniors can kind of self-administer to, you know, kind of trigger that, oh, maybe I do need to talk to a professional. So the Screen 8 is clearly administered by trained individuals. Has there been conversation then about a self-screen that might lead somebody to then search out that professional to do a Screen 8?
Yes, it's already been done. So there is a self-screen. Thank you for bringing that up. I will try and find it and put it in the chat box, but I think it's called Nutra E-Screen, N-U-T-R-I E-Screen. I think you can find it there. So there's one for older adults. That was also a part of Dr. Heather Keller's work. I think it's 14 questions. So yes. Okay.
Great, great.
I'll try and find the link right away.
Yeah, okay, thanks, Jen. The next question for you is, are you still looking for groups of seniors in other areas of Central Alberta to screen or provide nutrition education to?
Excellent question. So my group is not. However, with this screening success guide that we're working on, it's really set up for communities to take this on their own and run with it. So we just did it as a pilot. We came together as a group of interested agencies that really wanted to look at doing something for our older adults in terms of nutrition. So any community group can start their own screening program. So that's what we're hoping to get to help people with by doing this success guide. And if anybody, if anybody is interested in that, I do have some startup tools that you could look at, or we could share some of our resources. But yes, it's really to run within your own community. And Kathy, Dr. Kathy Chan, I see has just put in the chat box the self-administered questionnaire. Thank you so much.
Great, thank you, Jen. I'm not seeing any more questions. Anybody feel comfortable unmuting if they want to ask a question? Jen, I just have a comment that I was really pleased to see the addition of questions 9 and 10 in regards to food security and access to groceries. So I think that's certainly an area, if other communities are interested, would be important to include and kind of, I guess, align with if they have any food security working groups out there. I think that's important to note.
Our agencies wanted to know about that, so they asked to include those questions.
All right, Bonnie, I'm not seeing any further questions.
Okay, so thank you, Rita and Jennifer.
Sorry to interrupt.
Yep.
I see Catherine's hand is up.
Oh, okay.
Yeah, I was just going to add to the question about future involvement. As Jen said, we're really hoping that people will be able to pick up the ball and run with it with some help from the resources that are being developed. But Dr. Heather Keller and myself are also looking at further research opportunities, because this is an under-researched area and there is not a lot of literature about best practices for implementing nutrition screening in community settings. So if there were organizations, community-based organizations or healthcare settings that are interested in perhaps being part of a research program in the future, I would certainly be happy to hear from you. And I can put my email in the chat right at this very moment.
That's an amazing offer, people. Thank you, Catherine.
All right.
Bonnie, back to you then.
Okay, perfect. So thank you, Jennifer and Rita, for your presentations and for your expertise in these fall prevention and awareness topics. You have given us a lot to think about and take back to our organization. So thank you very much. All right, so we would like to invite everybody to join our core falls prevention group so we can continue these important conversations. You can join the core platform for free and find many resources, much like some of the resources that we discussed today, events, programs, and training all around Alberta. The platform looks like, oh, I've closed a link that I wanted to use, but that's okay. So Cindy, if you could, oh, perfect. There, our tech support has put in our core link to the group. The web address can be found in the chat, and you can be part of this community as we work together as a sector. We look forward to seeing you on CORE, and if you have any questions or comments regarding today's presentations, please direct them to healthyaging@calgaryunitedway.org, or contact our CORE group lead, Shelley Dallas-Smith, at we can put those, those emails in there as well. They're a bit long, so we can do that for you. Perfect. Thank you, tech support. And we'll add today's resources to our core group and keep an eye out for some of these updates. Our next session is going to be on June 15th from 10:30 till noon. It is titled Screening for Frailty and Falls in the Community, followed by a panel of community partners sharing their successes of collaboration falls prevention programs within our community. So we hope you're able to join us for that. Lastly, we'll be sending out an email with a short survey that we hope you're able to take a few minutes to complete. This will really help us gain insight into our events and how you feel in participating today. Improvements, things that we can add, everything like that. So thank you everybody for joining us today. It was absolutely wonderful to have you and share this information with you. I think that's about it. Thank you for joining us today.
Thank you.